Okay, now let's move down to the cheeks and everything else and look at some of the fat down there. And the first one that we're going to talk about is kind of the deepest of all the fats, save maybe the orbital fat, but it's called the buccal fat. And this is essentially your chipmunk cheek fat, right? Or your apple cheeks. If you see a little kid with big apple cheeks, it's the buccal fat, right? And we kind of have blocked all this stuff in on our skulls so far, right? We've put all these muscles in. We know kind of the relationship between all these structures, you know, skeletal muscles, zygomatic arch, temporalis. The big kind of cavities in the face have been just sitting there looking big and cavernous, right? This whole area kind of lateral to the teeth, superior and lateral to the teeth. Buccal fat, the buccal fat, is lives right on top of the buccinator, right? I told you about this a little bit ago. Buccinator is this guy, runs right over top of the teeth, grabs onto the corner of the mouth, and pulls the corner of the mouth along the teeth, essentially. We'll see more details about that when we get to expressions. But over top of that lives this fat pad, the buccal fat pad. So this big cavity in here is filled in with a nice structural piece of fat, and it actually goes up into this kind of malar fossa that we've been looking at. It's been kind of empty for us for a while now. So this actually then flares back behind the masseter, and in fact, in certain instances, it has a little extension that goes up kind of underneath the zygomatic arch into kind of this temporal fascia. Right, so it's a big thing. It's a big thing, and it varies in size on people. Some people, of course, following what we've talked about, the bell curve, like, you know, average person has a fairly neutral transition from mouth to masseter, right? That would be in here, a standard deviation either side. You go all the way out the bell curve either direction. This side you have hollow cheeks. This side you have chipmunk cheeks. And that's all just inflating or deflating this fat pad in the cheek that sits, remember, bounded by masseter and bounded by all of our muzzle and facial muscles in the front, right? We'll talk about those soon. Okay, in a nice kind of MRI cross-section, you can see a couple forms, right? To orient you, we're sliced kind of midway through the ears. You can see zygomatic arch here on this side anyways. This big thing here is the masseter. This big thing here is also the masseter. This is orbicularis oris, so the big mouth muscle. Right, orbicularis oculi, the orbital muscle of the eye, orbicularis oris, the orbital muscle of the mouth. Right, and you can see that essentially the cheek is just held out by this fat, this wedge of fat fills in this transition. And right, if you had no other fat on the face, right, if you didn't have any subcutaneous fat, this would give you a nice neutral transition from lips to masseter. This guy has a little bit of fat sitting in there in what is the malar fat pad. And so he's getting a combination of forms. If you dissected out the fat, it would look like this. And this is kind of turned on its side because I think that there was a mistake in orienting this. Right, so the anterior lobe is the one that's going to kind of go up into the zygomatic, that fossa. Right, this is going to be the bit that's just in front of the just posterior to the lips. I'll just draw this in place. Let me draw some lips here. This will maybe perhaps help orient you. Lips, nose, chin down here, masseter back here. Okay, this is getting a little out of control, but essentially, and not to scale either. I don't think I need to say that, but essentially we have some stuff hidden behind masseter and some stuff posterior to the orbicularis oris, and it's this fat pad, right? And that's it, right? So let's look at a couple images. Kind of a famous person, Amy Winehouse. You can see, we looked at her the other day, I think, for masseter, right? Kind of see the fullness of masseter here. If we kind of écorché her as best as we can, you know, we can see the widest point of the face going through the zygomatic bone. We can see a nice temporal line up here. So that's all coming down. Super young, right? So this is young Amy Winehouse, and she's still reasonably put together. Hadn't gone off the rails yet. And so all those things that we're talking about, signs of youth, are still in place, right? She has all of her orbital fat nicely retained. The SUF fat is where it should be, and just the neutral transition out to the cheek. Maybe some of the roof fat up here, make it a nice kind of upper brow. Down here we have masseter, and then sunglasses come across. And you can see how, so we have mandible coming down here as well, right? So the chin, the jaw coming out to the chin. This is a big piece of fat here, a big wedge of fat. This is not, that's just kind of reasonably neutral transition of the jawline. But this is the convexity of buccinate, of the buccal fat. Right, and this kind of extends up. There's a little bit of an extension that goes up here. And essentially, in that little fossa, that big kind of depression, we have, this becomes like the bed, like the little fatty bed for what ends up being a bunch of drawstrings, right? We're going to have a lot of lifters of the lip coming up to the margin of the orbit and to the zygomatic bone. And all those are going to slide over top of this deep muscle, okay? So just another view, and you can really kind of feel it there. Again, remember the boundaries, bounded in the front by orbicularis oris and some of the other muscles up here, and in the back by masseter. Okay, old Johnny Cash, right? Seeing a lot of convexity there. Super convex. And there's other things going on, right? We have some jowl fat and things, but this is the broadest convexity of this area is represented, is contributed to by the buccal fat, as is the case here, right? Obviously he has subcutaneous fat, but the big thing holding out this area is the buccal fat. All right, that's giving us that shape. Okay. People often go to the doctor, young people that want to be possibly more beautiful. They go and ask to have their chipmunk cheeks removed, right? And that's what this girl has done, right? She's gone in, and it's unknown whether she went in to get a nose job or to get her buccal fat out, but she got both. So maybe she was checking out and they upsold her or gave her a 2-for-1 special, right, to get a little bit of a rhinoplasty and to get her chipmunk cheeks out. The hazard of this for women especially is that once it's gone, you can't put it back, right? Once you excise some of that fat, you essentially are left with kind of subcutaneous fat transitioning in there, and maybe they leave a little bit, but it doesn't come back. And so as you get older, there's a good chance that you'll lose it, and you don't want to have big pits in your cheek if you're a woman, because you'll look like Ed Harris, right? This is what happens if you don't have buccal fat, right? And it's exactly as you would imagine, right? You have kind of the limit of kind of the facial muscles, so kind of this node of the mouth out here, which we'll talk about later. Bicularis oris. Masseter, you can see quite prominent, the masseter. And no surprise, if you're not kind of topped up with your buccal fat, you have a big concavity transitioning between these two forms, right? And it's always in the same place, right? There's no guesswork to this. And that's why we're learning it, so that you can just know the regions, masseteric region, the buccal region, the orbicular region, and then you put in the correct amount of stuff, whatever it is for your person, character, portrait, whatever. Okay, young Ed Harris, let me just erase this. You can see he had a little bit more, but still, if you had to get reasonably neutral, actually, transition from the node of the mouth to the masseter, a little bit concave, right? A little bit concave. But to be honest, he's a handsome man, so he even gets away with it in old age. But if you're a woman, it doesn't work as well. Okay, so now I'm going to show you an image, a couple images of something called lipodystrophy, right? So if you're easily grossed out, you should look away. Essentially, it's a problem with fat metabolism, so you're not able to store fat. And as you can imagine, the whole face goes a little bit suspicious and really, really skeletal. And this is what it looks like when you get lipodystrophy and you don't have facial fat stored in these compartments, right? Masseter is still there. Kind of the muzzle of the mouth remains relatively unchanged. A lot of kind of muscular components to that. A lot of more fibrous fat in there as well, more collagen. And you're left with, I mean, you can even see some of these facial muscles transitioning through there. But that's the big problem, is a big hollow in the cheek due to no buccal fat. Okay, so here's a couple of MRI cases just to kind of hammer home this idea of it being a good thing to have in your cheeks and not a bad thing. This girl shows up at the doctor and says, "Can you help me out? I have really hollow cheeks." And surely she does. They give her an MRI, and by now maybe you're used to reading this a little bit. Teeth, masseter, mouth, kind of orbicular region, and no transition between it, right? There's just this cavity. You can see it in cross-section, right? Concavity. So they inject some filler in there or some other fat, and now in the MRI you can see actually the transition is pretty clear, right? It's pretty neutral between masseter, mouth, and you get this nice soft transition. Fills it in, makes it less craggy. You don't want to be craggy if you're a woman. But then she goes back 6 months after the injection, and you can see in the MRI that it's kind of going away. She's losing it, and so I don't know, maybe she has to get topped up every 6 months for the rest of her life, or live with it, you know, one of those two. This girl shows up to the doctor and says, "Hey, doc, I've got really big chipmunk cheeks. I was wondering if you could help me out and take them out." And as a matter of course, he does an MRI to see what's actually in there. And it turns out that, in fact, she didn't have chipmunk cheeks at all. She just had super thick masseter, right, from chewing too much, I guess, or maybe bruxism, which I think is where you grind your teeth at night. And beyond that, kind of her buccal fat is fairly neutral, right? There's no big bulging component to this. That's just pretty neutral, a good, nice, soft smoothness of subcutaneous fat. And so in the end, I think the doctor, if he was a good guy, he sent her home and didn't charge her anything and said, we're not going to operate, there's nothing to take out, just don't chew as much. Okay, last case before we move on is something called Romberg's disease. And surely this is tragic, absolutely, but interesting to us from kind of an anatomical aspect. Because in Romberg's disease, half of the face along the line of symmetry, half of the body, in fact, along the line of the symmetry has lipodystrophy, kind of a lipid disorder. And so essentially this girl, 14 years old, has no fat on one half of her face. And so you can see the effect, right? Largely all the softness that we've been describing in the cheeks when you have everything in place, you know, when you're young and SUF is in the right place and buccal fat's in the right place. This is all nicely smooth and convex. Without it, it goes concave, and you're starting to see this foundation that we've been building, the skeleton, poking through, right? Here's the sunglasses in the orbit, and quite tragic. You can see it quite clearly in the MRI as well. Absolute absence of any of this subcutaneous fat or deep fat pads as well. Okay, that's it for the buccal fat. Next, we're going to talk about something called malar fat, which is the big kind of component to the middle of the face. And it transitions between the orbit and the mouth, right? This is the last thing that fills in the sunglasses right up to the surface. Okay, so let's look at a couple images. I'll take this first one from one of my favorite sculptures, Ugolino, by a French sculptor named Carpeaux. This is especially nice in marble. There's also a bronze version, which is far less attractive, but this one is beautiful. It's at the Met in New York. If you're hanging around New York, you should stop in to see it. So on this guy, Ugolino, the malar fat pad is this guy, right? And the big thing about the malar fat pad is it's essentially this wedge-shaped, this fan-shaped fat pad that, in fact, gives us bordered by two beautiful furrows that we really need to know: the infraorbital furrow, which we've already looked at, and nasolabial furrow, right? That's the other boundary of it. And nasolabial furrow is essentially that transition between cheek and muzzle, or cheek and the lips, and it wraps up over top of the nostrils, right? Remember, over top of the nostrils. Okay, and this is how it appears. The medial boundary for it is kind of the base of the nose, kind of where the nose meets the front of the sunglasses, right? Kind of that front plane of the maxilla. Okay, so this is transitioning to the nose. That's not fat pad down here, right? And this guy, the fat pad is like critical to youth, right? And the thing that happens as you age is it rolls off of this malar eminence out here, and gives you a view of the front of the sunglasses. And as soon as you start to see this front plane of sunglasses, you're going to look old, right? If we were going to make him young again, we would have to essentially take this and smear it back up over here, right? And this is what happens when you're young. This fat pad is a bigger fan shape that goes out like this. And eventually this either deflates or separates, and this sags down, deepens the nasolabial furrow, and exposes this this front wedge of the zygomatic bone. Okay, so let's look at a couple examples. Young and an old Robert De Niro. In youth, we still have evidence of these furrows, right? Except they're not really furrows, they're moored plane changes, right? And really the malar fat in youth is doing something like this, almost boundary with the orbicularis oculi, right? And all the stuff that kind of is associated with that. So that's what's happening in youth. As you age, this separates, and the bottom edge, which I didn't talk about, we talked about this border, we talked about this border, we talked about this border. The inferior border of this happens to coincide with more or less the line of zygomatic major, which is our big smile muscle, where zygomatic major goes from the corner of the mouth to the lateral face, just around the corner of the zygomatic bone, right? And that ends up being the bottom edge of it. Okay, and I'll erase the ink, and you can see in kind of youth, and then as the age gets more pronounced. Same again, right? Super young and beautiful Audrey Hepburn, and then an old Audrey Hepburn, right? Exact same facial structure, more or less the same pose. You can see actually quite a bit more exposed kind of zygomatic arch, but then you can see also this inferior boundary of the malar fat. Then you can see how it just kind of sits up here to the base of the nose. Not a lot of buccal fat in there, right? We can almost écorcher this. That being said, she doesn't have a lot of jowls either. A little bit of jowling right here. But for the most part, that's a concavity sitting here where the buccal fat would be holding it out, right? Normally that would be pushing it out. In youth, it's pushing it out. All the same muscle, the same zygomatic arch. They're all there, but it becomes an exercise in subtlety and transition of very subtle planes in youth, right? Which is why when you're drawing somebody that's young, you know, it's all about locating the features. They say that, you know, if you try to draw a beautiful face, the fewer lines, the better, right? So you have a few for this, a few for the eyes, a few for the mouth, a few for the nose. Nothing happening in here, right? Those are neutral. Okay, now, in old age, right? Sinks down. You can feel on this guy on the right, zygomatic major passing under it. And zygomatic major does pass under it. Remember, this is the uppermost superficial, right underneath the skin. Underneath this guy is all of our levator muscles of the lip and the corner of the mouth, and then deep to those muscles is the buccal fat. Okay, when you smile, as we have here, zygomatic major contracts, nasolabial furrow moves out, you get the smile kind of crease, and because malar fat lives on top of it, malar fat bulges up, and that's how you get kind of Santa cheeks. Even if you're super, super lean, when you smile, it still pops whatever you have left of your buccal fat, or of your malar fat, pops it up and makes it bulge. Okay, we'll talk more about that in expressions. Okay, that's that. You can feel the front plane of the zygomatic bone there. And then we can also see kind of this kind of sharp boundary of zygomatic major, kind of scaffolding that up, right? You see how it just kind of terminates as it goes over top of that. Okay, so again, without malar fat, more lipodystrophy, you can see the skull that we've been studying, right? And that's not really good. Essentially, you want to take this little wedge and fill it in. So it's kind of a combination of two things. It's absence of malar fat, and it's also the absence of buccal fat. Both of those contribute to the depth and or the fullness in this area. Malar being the most superficial, though. Okay, so again, this guy, in the scheme of things, the grand scheme of things, relative to some of the horrific things we've seen so far, this guy is in pretty good shape. But for some reason, he felt that he looked too rugged, I guess, and he wanted to look a little bit more jolly. So he went in to get a malar augmentation, and essentially to fill in that transition right there, that front wedge of the zygomatic bone. And so they did. They filled him up nicely, right? He's got a huge apple there. That's a big smile cheek that you can't get rid of it. It's that permanently, even when he's grumpy, you know, or maybe he's grumpy because he's always smiling. But when you go in to get something like that, this is what they do. They put these little silicone wedges in. Apparently, there are probably multiple ways, but imagine this is kind of oriented in a funny way, so I'm going to draw nasolabial furrow, infraorbital furrow, nose, lips, and all our eye up here, right? So they just wedged this in, and presumably it fills things up a little bit. Yeah, crazy. Here's a little dissection image coming up, and this is showing a cross section through the face. Again, pretty gross. Turn off if you can't handle it. But it's a little bit instructive because it's showing us how all these layers live. Orient you, we're looking down the cheek. This is obviously a cadaver, so don't worry about it. It's not an operation picture. Looking down the nose, the eye is up here somewhere. And nasolabial furrow is starting here and going down. Right, and so what we're seeing is, most superficially, this section is the malar fat. We're seeing the levator muscles, right, that I said existed in this intermediate layer. Essentially, these muscles, or muscles of expression, are just gliding between these two pads of fat. And that's what they say. They say that all these facial muscles have little bits of fat around it so that they can slide. And then deep to that is that extension of the buccal fat. Okay, just a couple more examples. Fat guy is back, this time to show off his malar fat. Again, when we're looking at trying to establish the character of a portrait, one of the quickest ways to just identify or get familiar with the structure of a person is to look at how much space or how parallel or divergent these two furrows are, right? Because they'll tell you a lot about the center of the face, and they'll get you started. They give you a broad idea of kind of the length of the nose, the depth of the malar kind of region, the zygomatic bone. They set up a lot of transitions, so always you can just look at those and see if somebody's, how to start construction of this area by how parallel these are, or equally how divergent, like something like this. Okay, for example, Frank Sinatra, right? This is actually fairly divergent, right? compared to what we were just looking at. A little bit parallel up here, and then they diverge, and you can kind of see a little bit of SOOF there, a little bit of SOOF here. And then as he gets a little bit older, you can see huge, distinct transitions between kind of SOOF fat, orbicularis oculi. This is a big one here. And then just kind of really kind of sagged and full malar fat. Okay, last image in this malar fat section is this old granny looking quite wrinkled in a few areas, right? So done a lot of smoking. I can tell she's done a lot of smoking because she's got a lot. Look at all these wrinkles through here only happen from smoking, to be honest. That's just like continual contraction of orbicularis oris. Got a lot of smiling. We can see these, and also we can see down here a lot of smiling. But it's really interesting to see that the malar fat is unwrinkled, entirely unwrinkled, right? And that's because of what I had said earlier, that the zygomatic major passes right underneath it, right? So when this gets pulled into a smile, all of this stuff is like curtains, like you're drawing back the curtains. But this fat pad is structural enough that it doesn't bend like that, and it's full enough, so it just puffs up and remains relatively unaffected by that expression. Okay, now we are going to complicate things a little bit and talk more about individual compartments within the subcutaneous fat. Malar fat is one of them, but there are a few other places that fat will kind of tectonically separate, and we're going to talk about those in part 3.